Hello, my name is Ethan, and I will be your student nurse practitioner today. And so, what we are going to be doing today is we are going to be doing a head-to-toe assessment. So, we're going to take a general look at just about every organ system and everything like that. So, first of all, do you have any complaints or concerns or anything that you'd like for me to check out specifically? Okay. So what we're going to do, first thing I want to do is just kind of give you a listen. I'm going to listen to both your heart and your lungs. We're going to start with listening to your heart and listen to all 5 heart sounds, okay? And so the biggest one I want to listen to is the apex, which is located right here under your left breast. So you don't have to take deep breaths or anything like that. And so what I'm looking for is S1 and S2 sounds, a lub dub type sound, regular rate, right here, right there. All right, now I'm going to listen to your lung sounds, take a deep breath. Here. Okay. Now I'm going to listen to one more time. Listen back again. So now I'm going to go to the lower side of it, lower lobes. And again. And so what I was listening for is I was listening for S1, S2 sounds. There was no indication that there was any S3 or S4 sounds, which is a good thing. And so it was regular rate, regular rhythm. And so for your lungs, it was clear bilaterally. So on both sides, I went from left to right for that reason. To compare, there's no wheezing, there was no deafening or lack of hearing or anything like that. So with that, the next thing I would do is I want to go ahead and listen to your abdomen and also take that, but because you're pregnant, I'm not going to just start punching on your stomach right now. What I would actually listen to all 4 quadrants looking for bowel sounds. I would also start to palpate each quadrant just to see if there's any pain for that. And so I'd have you lay down. But for sake of the video, we won't be doing that. But the next thing I want to do is I want to just basically go from head to toe, make sure there's no injuries or soft spots in the cranium and whatnot. So I'm actually going to approach you and I'm going to come up to you and I'm going to just kind of feel here, see if I can find any abrasions and to make sure everything feels all right. No flat spots, no pain. Okay. Feel right here for lymph nodes, no lymph nodes, issues like that. I want you to open your eyes. Okay. I want you to squint your eyes as hard as you can. There you go. I want you to stick your tongue out for me. There you go. I want you to go ahead and I want you to look at this finger. And right now what I'm assessing is multiple cranial nerves. And what I'm checking right now is I want to look at your oculomotor cranial nerve. So what I want you to do is I want you to follow my finger without moving your face or moving your head. So your pupils should be following it. Ready? So I'm going to look at all 6 vocal fields. There we go. All right, perfect. Now what I want to do is I want you to look at my finger and I'm going to actually check to see if your pupils are reactive to light, okay? So I'm going to shine a light in your eye, looking for constriction. So constriction and then, there you go. Good. So you got equal bilateral pupil restriction when looking at light. So next thing that I want to do is I want to go ahead and assess your ears and just assess that your eardrum looks right and everything like that. So what I'll use, this tool right here, cystoscope, and I'm just going to make sure that I can see the eardrum, make sure there's no reddening or anything like that. I'm going to pull back right here. Okay, right there. All right, I can see. There we go. The tympanic membrane's intact, no injury. We go to this other side and do the same thing. Change hands real quick. Pull up and back. Membrane intact, no edema or any redness or anything like that. Alright. And so what I also want to do is go ahead and check circulation and go from there. So the biggest things that I'll be checking is your radial pulses. So as your pedal pulses, if you were not to have those, I would continue going up until I was to find one. And so that would indicate that there's not circulation below though, or there's poor circulation. So what I would do is I would check right here, that radial bone, so pulse right there, pulse right there. And you got shoes on right now, so I'm not gonna do it, but I would actually do it right here, okay? Now what I want to do is I wanna go ahead and check some reflexes, which can indicate some different functioning with your spine. And so first thing that I want to do is I want to check the brachial reflex right here. Get your arm, there you go. I want you to, well, this is your, not your brachial, but your tricep right here. So it's gonna kind of pull this out this way when you relax it. There you go. Relax that for me. There you go, we should see a little bit of flexion right there. There we go. Do the same thing on this side. Make sure it's equal. There we go. Kind of relax it. Right there. Perfect. Now what we'll do is we'll actually have this right here. We'll hit it right here in the middle. Find that bone. Kind of flex it for me a little bit. There you go. Find that tendon right there. And then it should have a little bit of flexion. Perfect. One more time. There you go. Found it. There we go. Perfect. All right. There we go. Now what I'm going to do is I'm going to go to your knees. So just try to relax this knee the best you can. There we go. Beautiful. Looking to make sure there's no hyper reflex or anything like that.